Hello everyone, welcome back to our channel. I'm Dr. Ramel from City Skin Clinic, and today I thought we'd have a little chat about excess sweating and what causes that and what kind of treatments are available. This is a subject that affects quite a lot of people. There's a lot of confusion about what comprises excess sweating and how to treat it. A lot of people think that there's only one treatment, for example, like Botox for excess sweating, but that's not always the case. It's not always appropriate. So this video is going to kind of discuss the different causes of excess sweating and what kind of treatments are available for it. And how to decide what's best for you. Before I start, if you're new to our channel, welcome. Please don't forget to subscribe. If you are a returning subscriber, welcome back. At the end of this video, I will leave some links to relevant videos that might be helpful. So what is excess sweating? So we know that we have millions of sweat glands all over our body, and sweating is actually a really important natural function. It's a way for our body to regulate our temperature, so it's really part and parcel of life, and we need sweat glands. However, sweating can be problematic when it's excessive and it's inappropriate. So situations like that, maybe you kind of may have generalized sweating, so you wake up, for example, in the middle of the night drenched in sweat, even though it's not particularly hot, or it might be localized sweating, where, for example, your palms get super sweaty and wet just when you're nervous. And everything in between. So these, in those situations, sweating can actually be quite harmful to our general life. So you may be someone who has a job where you have to interact with people, and find that sweating excessively either in your palms or on your face or even armpits is getting in the way of doing your work, or generalized sweating is also not something that most people tolerate well. Other things that can happen alongside excess sweating is if there is also body odor, and body odor is caused by bacteria on our skin that kind of feeds on the sweat. I know it sounds disgusting, but it does, it feeds on that, and so that can then give rise to body odor. So it can just be pretty debilitating. So thankfully, there are treatments, and there are ways that you can help yourself as well. So before you kind of jump into how to treat excess sweating, you need to kind of firstly try and figure out what kind of excess sweating you have. Is it generalized sweating? So do you sweat all over your body without any obvious reason for this? If you are someone who just will sweat all over the body, it's called generalized sweating, and there are things that have to be excluded. So normally generalized sweating is due to something else that's going on. So for example, things like hormonal changes and imbalances can affect this, and that includes things like the menopause. So if there's a hormonal underlying reason, then treating that will help with the excess sweating. Excess sweating can also be a sign of something wrong in the body. So things, diseases like excess thyroid activity, so hyperthyroidism can cause that. Diabetes can cause excess sweating. You also can have things like, and this is not an exhaustive list, there are many diseases, but I'm just kind of mentioning the key examples. Even more worrying things like lymphoma can also, a sign of that can be excess sweating. So I don't want to scare you, but it's just important to know that there may be underlying signs to underlying causes of excess sweating. Generally there are. Other things that can cause excess sweating, generalized excess sweating, can be medications. So some medications may be a side effect of that. And of course, in that situation, if there's excess sweating is caused by a medication, then your doctor may be able to adapt your medication to eliminate this. And then there are other things like stress. Stress can give rise to things like night sweats as well, and excess sweating. So that's something that if it is due to stress, stress management is going to be far more effective at combating this. And then kind of other things like infection can also give rise to excess sweating. So big infections, things like TB, can also cause you to have excess sweating at night. So it's really important, if you do have generalized excess sweating or any type of kind of excess sweating, but particularly generalized, your first point of contact should be your general practitioner, your GP, or if you're, American or in the rest of the world, your physician, your family physician. That doctor will examine you. They will get a good history of what's kind of happening with you. They may want to do tests as well, and that will help determine if there is an underlying cause to your excess sweating. If there is an underlying cause, then that will need to be treated, and treating that underlying cause is going to treat the excess sweating. The other thing that they can then do if there isn't an underlying cause for excess sweating is start to treat the excessive sweating itself. So once they've excluded that there isn't an underlying cause, there are certain treatments that can be available. So things like medications, so there are medications that reduce sweating activity, and even things like surgery. So surgery, which is quite invasive, but can sort of lock or cut the nerves that cause sweating, or they can remove sweat glands in certain places that are causing you the most trouble. Obviously, these are quite invasive, and usually they would not be attempted before less severe and more practical things can be done, and that includes medications, can include if the sweating is generalized but it's only affecting certain areas, say your armpits, your palms, whatever. There are products that can be applied to the skin that kind of dampen down that sweating. So again, it's really important to discuss your options with your doctor and try the least invasive things first. Then that's kind of generalized sweating, but what about localized sweating? So by that I mean isolated areas that sweat excessively. So this is the one that we kind of get a lot of questions about, and it's a condition called hyperhidrosis. So hyperhidrosis is excess sweating, and most commonly people will describe excessively sweaty palms, excess sweating on the soles of their feet. Scalp is another area that gets massively affected, under the armpits, of course, in the groins, and also the face. So usually most people won't have more than one area that gets affected, sometimes two, but it's usually discrete. Whilst there isn't an obvious reason for a lot of these cases, it's again really important, if you've just started to suffer from this, or even if it's been ongoing, to just touch base with your doctor and just make sure there isn't something else brewing that this is a sign of. If everything's fine and you're healthy and it really is just the sweating that's affecting you, then there are different treatments that can help you. So what you do with these treatments and which one works and what doesn't will just really depend on just how your body responds, and also things like your lifestyle, your budget, and how much this affects you. So I'll start from kind of least invasive all the way to kind of more involved procedures. And so the first thing that can be applied there are topical antiperspirants that are designed specifically for excess sweating, and these are applied to the skin, and they can help reduce sweating. They're not perfect, they're not going to stop it all, and for some people they don't really see much of an effect, or if they do see an effect, they don't like the products themselves, they don't like the effect that these products have on their skin. But it is worth at least considering these, because this is the easiest and in a way the cheapest, but it is a commitment, and it's something that you have to do regularly, in the same way that you would put a deodorant under your armpits. These antiperspirants have to be applied regularly. But these are kind of the smallest and quickest and easiest and cheapest thing that you could do. There are other things that can be approached. So perhaps if you have excess sweating in more than one area, then your doctor may consider putting you on a medication. The problem with medications that reduce sweating is they don't just reduce it in that specific area, they will do it for everywhere. And so this may not be the right option if you just have a localized, isolated area of sweating. Other things that can be done are kind of electrical therapy, where they just stimulate the kind of nerves, and that reduces sweating in that area. So this is a treatment that has to happen in a clinical setting. It's not permanent, it is temporary and does need to be repeated, but that is something that can help with excess sweating. And then one of the things that gets a lot of popularity is Botox for excess sweating. So when we normally use Botox, it's to relax muscles, and usually in the context of doing the non-surgical neck lift or gummy smiles or wrinkles in the face. But Botox for excess sweating, it's injected superficially, so into the skin. And what that does is it blocks the nerve signals that cause sweating. So what you do is, if it's injected into the hands, for example, it'll stop the sweating signals in the hands. The same for any of the areas that I mentioned before. It's very popular for the hands, the soles of the feet, in the armpits, face, the scalp. These are all, really popular areas for Botox injections. And the way it works is by blocking those signals that cause sweating. The thing with Botox injections, it's like most Botox, it's not immediate, so you need to wait a few days before you start to notice the effect. And then it'll settle into full effect within a couple of weeks, usually. Normally, the results can last anything between 5 to 6 months. Sometimes I've seen in some patients where it lasts even longer than that. It does vary from person to person, but the effect is longer than when you use Botox for relaxing muscles and wrinkle reduction. It does involve way more injections than you put into, let's say, when you want to relax the muscles on the face and treat wrinkles. And usually these injections are spaced out, but there's quite a lot of injections if you want to, say, inject the hands or anywhere else. This is also a really advanced procedure. So all Botox should be delivered by a medical professional, and this needs to be someone who is especially trained in doing Botox for excess sweating, because, especially if you're injecting the face or the hands, what you want is the Botox to work on the sweat glands, but you don't want it to migrate and cause side effects by, weakening the hands a little, or by if it migrates into the muscle. You don't want someone to accidentally inject it into the wrong area in the face, and then you get an asymmetric smile or a lid droop or anything like that. So it is important to go to a medical professional who is trained and qualified and experienced in treating Botox in these areas. So that's it's a great treatment, but it is temporary, and people do really well with this treatment. It's very popular for that reason. And then the next one up is a treatment that actually uses thermal energy to kind of affect the sweat glands, and it basically destroys them. And this is known as miraDry, and it's a treatment. The thing looks like a laser probe, and it targets the sweat glands in those discrete areas, and it gets rid of them normally forever. It is a permanent treatment, and it may require several courses of treatment, but it offers a lifelong solution. So in terms of effectiveness, usually Botox and miraDry have really, really good results, high patient satisfaction. miraDry is obviously more expensive than Botox, but with that treatment, it's lifelong. And so that's something else that's worth thinking about when you're thinking of the treatment. One big thing that people ask about, if you have excess sweating and you use, let's say, Botox, or so excess sweating in, one or two areas, and you use Botox or you use miraDry to stop sweating in that area, is that harmful to your body? The answer is absolutely not. You know, you have millions of sweat glands all over your body, and you know, the glands in those areas, maybe 1 or 2% of your overall sweat glands. So it's not going to affect your body's ability to regulate temperature through sweating. Then other things that people ask, if I treat the area that's excessively sweating, will another area start excessively sweating to compensate? This isn't really something that's seen in practice, so it's not a known side effect of these treatments, and most people don't notice that. What they do notice is initially it's more of a psychological thing. So when they come across a triggering situation where something that normally causes them to excessively sweat happens, they expect to sweat excessively, but they don't. They're dry, and that takes a little time to get your head round that actually, no, that thing isn't going to happen anymore. So that's something that people commonly report. Anyway, I really hope that this video is useful if you are someone with excess sweating or you know someone that suffers from it. There are a lot of treatments that are available, but remember, this is a journey, and the first thing to do is just make sure that health-wise you're well and there isn't a more sinister reason causing this. And if there isn't, then there are kind of an array of treatments that are worth trying, and not to be disheartened if one treatment doesn't get you the result you want. There are others available. It's just important to speak to someone who is going to help you with these decisions and guide you through these journeys. There are also lots of organizations that provide support for people with excess sweating, and I will leave a link below this video. And you know, if you are someone who has excess sweating and there's an underlying medical condition, again, you know, it's probably scary and frightening to think that this may be the case, but really getting that underlying treatment sorted is not just good for your health, but it will also help eliminate the excess sweating. What I want to say is there is a light at the end of the tunnel, but it starts with kind of making that contact with your doctor.